Hello and welcome to Health Dialogue Show. I am Dr. Bhumika and January marks Cervical Cancer Awareness Month, a time dedicated to raising awareness, promoting prevention and educating people about the importance of early detection. In today's discussion, we'll explore key facts about cervical cancer, the latest advancements in treatment and how to reduce your risk. Plus, we'll take on some common myths in our Mythbuster round, providing you with the essential knowledge to make informed health decisions. To help us understand this critical issue, we are joined by Dr. Janaki M.G and Dr. Sudeshna today. Dr. Janaki M.G is an MBBS, MD Radiation Oncology, DNP Radiation Oncology with 28 years of experience overall. She was involved for evolving guidelines for radiotherapeutic management of cervical cancer with special emphasis on high-dose rate brachytherapy through Indian Brachytherapy Society. She is one of the reviewers for many prestigious cancer research journals. She has also received the Researcher Award for the most number of publications in 2021. Dr. Sudeshna is an obstetrician and gynecologist. She brings with her an experience of more than 24 years in the field. She specialized in treating normal and problematic pregnancies and all forms of scarless, and robotic gynecological surgeries. She has a keen interest in academics and puts a conscious and constant effort in updating herself through teaching, reading, and writing in national and international publications and participating as a faculty in conferences. I welcome you both to our show, ma'am. It's a pleasure to have you on board here with us.
Thank you.
Thank you.
Thank you, Dr. Bhumika.
My first question is to you, Sudeshna ma'am. What are the primary risk factors for cervical cancer?
Right. Cervical cancer is basically caused by a virus called HPV, human papilloma virus. There are many, the only way HPV can come into somebody's body is through sexual contact. But there are many associations that we say that if you start having sex at the younger age, okay, less than 18 years of age or less than 20 years of age, your risk for cervical cancer increases because you don't have the ability to fight against that virus at that point of time. So persistent HPV can be also happening from different partners, so multiple sexual partners. Also, there are certain associations, again, not causative factors, not causes that, but we have seen that smoking increases risk of cervical cancer. Sometimes oral contraceptive pills increase the risk of cervical cancer. So this, we can say this, that the researchers have seen that when you use oral contraceptive pills, your inhibition of having sex without protection goes away. For example, they say that, okay, I am on pills, so I can have unprotected sex, but without a condom sex. So that can lead to a more spread of HPV, and basically these are the risk factors for cervical cancer. Anything related to premature sex or associated factors of lifestyle. Sometimes there are certain studies which talk about healthiness or not taking the hygienic treatment, like hygienic care of the cervix. But again, this is a very I would say it's controversial. So the only thing that we can think about cervical cancer, prevention of cervical cancer can be happening in various, like we can prevent it from the beginning. We can prevent it like a secondary prevention. We can, of course, prevent it as a tertiary prevention. So primary prevention is the lifestyle that we spoke about. Secondary prevention is always doing a pap smear and understanding. Please, for everyone all out there, cervical cancer can be completely preventable. So it is 100% almost preventable condition because we can detect a definite precancerous stage in cervical cancer. That's the best news of any cancer, that we can detect it in a precancerous stage where we can treat the precancer and prevent the cancer completely. And of course, we have vaccination. So these are the different tiers of prevention of cervical cancer.
So my next question is to you, Janaki ma'am. How often should women get screened for cervical cancer?
As madam explained, the HPV infection starts at the first sexual contact, and generally it is advised from 25 to 30 years onwards. the first pap smear has to be done, and once in 3 years at least it has to be done. It has to be continued up to the age of 65 years. The reason for doing this quite often is, unlike other cancers in the body, we know that HPV is the most commonest cause. HPV infection to the actual onset of cancer, it takes anywhere between 10 to 15 years. So we have a large window period where definitely all of us in the reproductive age group, we go and meet the obstetrician, at least for delivery, antenatal care, post birth care, and all those things. So these are the times where we can actually pick up very early precancerous conditions. And in these precancerous conditions, again, many of them, almost 1/3 to 2/3 of them, will revert back to normal cervical epithelium. It's only 1/3, that too in advanced dysplasia, that is grade 3 dysplasia, will go in for malignancy, and it takes 10 to 15 years. So I think this is one of the cancers in the body which can be easily prevented with minimal awareness, and anyway we are going to the doctors during that period. So that is the best thing to have for cervical cancer, so that we can pick up very early and prevent it from going into malignancy.
Right, ma'am. Right. Okay, so my next question is to you, Sudeshna ma'am. Can men be affected by HPV? Is there a possibility?
Yes. So men can also be affected by HPV. Human papillomavirus is something which can have a problem with men also and female also. So the whole point here is the persistence of the virus. It is not only the virus which is causing it. If the body has that immunity to fight that virus, and mostly all women and men fight that virus away. But if it is persistent in men also, it can cause penile cancer, like cancer of the penis. It can cause anal cancer. Sometimes it can even cause throat cancer or oral cancers.
All right.
So yes.
Yeah. So my next question is to you, Janaki ma'am. What are the symptoms of cervical cancer?
Many of them do not have any symptoms, so cash on routine examination can be picked up. But the earliest sign is the bleeding after sexual contact. That's the earliest sign. That is a warning sign. So if anyone has bleeding after sexual intercourse, immediately they have to report to the doctor. It starts at that lining, and from there it spreads in different directions. So based on spreading in different directions, patients can have white discharge, patient can have bleeding, altered cycles. In between menstrual cycles, they can have bleeding. They can pass lots of clots, and they can have, because this spreads laterally on either side of the uterus, involving the nerve, they can have low back pain. The pain can radiate to the legs, and in front it can go to the bladder, backside it can go to the rectum. So they can have difficulty in passing urine. Regular bowel habits can be impaired, and very rarely there could be some collection in the uterus because of the growth blocking the uterine canal. So they can have a lower abdominal pain. So these are the common symptoms that they will have, but many times it can be without symptoms. Accidentally also it can be picked up. That is the reason awareness has to be created for screening, so that we can pick up early even when there are no symptoms. But most important thing is postcoital bleeding or bleeding after sexual intercourse.
Right. That's something many people don't know, maybe. So this is like the awareness should be spread, right? So my next question is again to you, Sudeshna ma'am. What can women do to prevent cervical cancer?
Okay, so the first thing that let me add on, let me emphasize what Dr. Janaki has said to the previous question, that most of the times we don't have symptoms. Like, in fact, that is one precursor to prevention question that you have asked just before, is that by the time you have symptoms, it's already late. So don't wait for symptoms. Do the checkups at a time when there is no symptoms, so that you can pick up before you can have symptoms. So in case of prevention for cervical cancer, again the same thing, that you have to, if you want to primarily prevent, restrict your medical partners, always sexual partners, always insist on sex with condoms. That condom is the only way you can prevent a virus from spreading from the man to the woman. or the woman to the man. So there is, that's the only way. So in whether you are not on oral contraceptive pills, if you are not sure of a partner, if you are not in a what do we call it, as a committed relationship, if you're, then just always insist on using condoms. Okay, that's a primary prevention. Secondary, as I said, that you can prevent cancer by doing pap smears. You know, as Dr. Janaki said, it's fantastically that, you know, that's the time when you will definitely go to a gynecologist for something. So just extend one, like if you're in the pregnancy, you can't do a pap smear. Just before pre-pregnancy counsel, you can get a, you know, we are now having a lot of young women coming to us and understanding how to get into a healthy pregnancy. That's the time when both as a doctor should be proactive in doing the pap smear, and the woman should be ready to do the pap smear at that point. Post birth, they can do a pap smear. So that's the secondary prevention that we are talking about. And of course, the third is a vaccination that we can also prescribe nowadays to prevent cervical cancer. Now, again, the vaccination is not to prevent the cancer. The vaccination is to boost up your immunity to, like, get rid of that virus. It is not cervical cancer vaccination, it's an HPV vaccination. So the vaccination is done to boost up your immunity so that you can get rid of that HPV or human papilloma virus, which is the cause of the cervical cancer. But because it does not prevent cancer as such, because it prevents only HPV, you have to continue doing your pap smears even after cervical cancer vaccination. Not that I have taken a shot and I don't need a pap smear. You still will need a pap smear because there are many other strains of HPV which is not covered by your vaccination, which can cause cancer. But the vaccination covers the most prominent viruses, strains which cause cancer. If that answers that question.
Can you also elaborate on the HPV vaccine, like its safety and when should it be given?
So the best time to give HPV vaccination nowadays, it is coming into the in pediatric vaccination schedule also, because the best time we find is the time that we give it before one gets sexually active. Now in some countries sexual activity starts even at 14, so they can give it at 11 years of age. In India, if you see the research, the initiation of sexual activity, the year is about 17. So we can think about giving any time before 15 years of age. That's the best time to give the vaccination because you are already building up the immunity, so before the virus attacks. However, you're never late to miss the bus. If you have, you are never late. So if you have missed the bus in the adolescent period, you can still take it. Adult who have gone beyond like 10 years of sexual activity or have multiple partners since the last 5-6 years at the age of 40 or so, that is a questionable age to take a vaccination, though companies are recommending it. But we are seeing some studies which are picking up small issues which are more prominent in adult vaccination than an adolescent or a young age vaccination. So I think up to 26 is a very safe age for vaccination. If somebody is suffering from immunocompromise, like if somebody is HPV positive or if somebody is having a malignancy, those are the immunocompromised, like the immunity is very low for them. For them, or somebody has a risky behavior, like multiple partners, those are the ones we can still consider it as an adult vaccination. But with a single partner since a long period of time and HPV being negative for long time, I think 26 is a good age to call it as an end line for vaccination.
Right, ma'am. Right. That's a very important piece of information. My next question is to you, Janaki ma'am. What treatments are available for cervical cancer currently?
It's the treatment for cervical cancer basically depends on the stage. Okay, a very early lesion where it has started in the mucosa, it is just confined to the mucosa, it has just breached the mucosa, or it is confined to cervix. It's not too big, and it is not a higher grade tumor. These are best operated, and the uterus would be removed, and there ends the treatment. No, nothing else is required. Anything which has gone beyond the cervix, say on the sides or in front or in the back, we call it as anything that is above stage 2. And anything that is bulky, even in stage 1, if it is very bulky or it is huge, then radiation is the standard treatment of choice. With advanced stages, radiation alone may not be useful, so we add along with that chemotherapy also, small doses of chemotherapy given every week, that will enhance the effect of radiation. These are the standard treatments that are available. And in radiation, again, we have a combination of external radiation and internal or brachytherapy radiation. So with this, the control rates are very good. So in a sentence, if I have to say, very early lesions are treated by surgery, and rest of the cases are treated with radiation alone or with or without therapy. And if it is spread everywhere, stage 4 disease, then it will be just a palliative treatment just to control the symptoms. This is the standard line of treatment for cervical cancer. And with this treatment, the control rate is excellent. Now, so much of advances have happened in radiation, internal radiation especially. Earlier, we used to have overall survival rate of around 40-50%, overall stages put together. Now we have, with image guided brachytherapy, we say the control rates are very high, as high as 70-75 overall put together. And in very early stages, it's as high as 90-95%. So I don't think even if anybody is diagnosed as cervical cancer, you should worry about it. Unlike many other cancers in the body, cervical cancer is very much curable. You have to approach the doctor, don't neglect. Earlier the better, but still treatment is very effective.
Right.
You know what I like about oncologists are they always give us a hope. We even as gynecologists, even as doctors, we always worry about the word cancer. But if you speak to an oncologist in any form, whether it's a surgical oncologist or a medical oncologist or a radiation oncologist, they will always say cancer is the only disease that I can cure. The other diseases you can control. So it's lovely to hear that, Dr. Janaki. That's a very positive message, I feel, that even if you have been detected with cervical cancer, it is not that it's a death sentence.
I just want to add one more. I have been in this field for the past almost 32 years. As a student, I used to see a lot of patients who were coming at a very advanced stage. It was quite sad to see them not getting cured. Nowadays, we get patients who are treated and who come for follow-up 10 years, 15 years, 20 years. All that is because of a very advances that have happened in all the fields, surgery, radiation, medical oncology, everything. So I think it's not what it was earlier. So I think there should be no hesitation in approaching the doctor at the minimum symptoms.
Absolutely.
Right. Okay, so now moving on to the Mythbuster round. So I have a few statements with me here, and if you could just tell me if it's a fact or a myth. So my first statement is to you, Sudeshna ma'am. Cervical cancer is only caused by HPV. So what is your take on this statement?
Right. There are two types of main cervical cancer. The 85% of the cancers are one type and 15% are the other type. So the 85% of the cancers are caused by HPV. 15% of the cancers are caused by something else which is different, which we cannot detect, and that's why there is no precancerous stage in that type of cancer, and we cannot prevent that cancer, and we cannot that. But unfortunately, that's rare. Fortunately, that's rare. So 85% of the squamous cell carcinoma that we call it is caused by HPV. So you can say the myth is largely true. It's not a myth. But it is not only one type of cervical cancer that we deal with. There is a small percentage of another type of cervical cancer which is not caused by HPV.
All right. So my next statement is to you, Janaki ma'am. If you've had one abnormal pap test, you have cervical cancer. So is it true?
Completely wrong. Okay, any
Right.
abnormal pap smear, so it has to be followed up with another pap smear little later after the regular medications are over. And even if any pap smear doubtful is there, it is always followed with multiple other tests like colposcopy, guided biopsy, and all those things. So just a pap smear does not mean, just an abnormal pap smear does not mean anything.
Right, ma'am. Okay, so my next statement is for you, ma'am, Sudeshna ma'am. Cervical cancer only affects women who are sexually active.
Again, 85% of the cervical cancer is caused by HPV only affects women who are sexually active. 15% of the cervical cancers, which are not HPV related, can happen to even sexually inactive women.
Right, right. Okay, the next statement for you, Janaki ma'am. Having the HPV vaccine guarantees you won't get cervical cancer. So what is your take on this statement?
It's a myth. Okay, as already explained, there are a lot of other reasons for cervical cancer, number one. And number two, HPV only, like, it doesn't act on the disease as such. It boosts up your immunity. Okay, so there are a lot of other reasons. So I've taken HPV vaccination, I will not get cancer, is completely wrong. That is the reason, in spite of taking HPV vaccination, regular screening with pap smear is mandatory and compulsory.
All right, ma'am. My last statement is for you, Sudeshna ma'am. You don't need a pap test if you've had the HPV vaccine.
So, as Dr. Janaki said, that it is absolutely essential and mandatory. Even if you have the vaccination, you should go in for your regular pap smears, because that's the only way we can pick up a problem which is not covered by vaccination.
Right, right. Thank you so much for your time, ma'am. Both of you. It was a pleasure having you here. Thank you.